everyone, my name is Cucumber Boy, and today I'm going to be reading some science facts. Ready? The diagnosis of malaria, which is most commonly imported tropical disease in the UK. The likely microorganism is Plasmodium species, a single-cord protozoan parasite. Plasmodium falciparum is the most common. Plasmodium vivax is the second most common. It has dominant liver stages that may cause relapses. Plasmodium ovale is mostly found in the West Africa, and it has dormant liver stages too. And if untreated, may cause chronic infection. The natural hosts of Plasmodium nooses are monkeys. Malaria is also spread by female mosquitoes. It's presented by having fevers, sweating, rigors, headache, fatigue, lethargy, weakness, myalgia, arthralgia, nausea, vomiting, abdominal pain, diarrhea, hepatomegaly, palate, jaundice. Thick and thin blood films indicate trophozoites. Rapid diagnostic dates for malaria antigens. Full blood count tests, as anemia is common, and thrombocytopenia suggest P. falciparum. Clotting screen for prolonged PT. Uncomplicated P. falciparum malaria can be treated with an oral artemether lumefantrine. IV artesunate is the first treatment for severe P. falciparum malaria. Non-falciparum malaria is usually treated with oral chloroquine plus pyrimequine for Vivax ovale. Acute kidney injury, decimated intravascular coagulation, acute respiratory distress syndromes, severe anemia, especially in young children, and hypoglycemia, metabolic acidosis, and cerebral malaria is coma are some common complications. A 22-year-old woman presents with a dry cough, fever, night sweats, and poor appetite. She thinks she may have unintentionally lost some weight. Her chest X-ray is shown below. The answer is tuberculosis. Mycobacterium tuberculosis, a rod-shaped aerobic bacteria. Active TB presents with cough, hemoptysis, dyspnea, and systemic symptoms such as low-grade fever, malaise, drenching night sweats, anorexia, weight loss. Examine may reveal lymphadenopathy and finger clubbing if long-standing. Auscultation is often normal, but can reveal crackles. Chest X-ray for upper zone constellation, plus cavitation, lymphadenopathy, and pleural effusion. Sputum for cyanide stained culture, and nucleic acid amplification tests, and an urine, sweat, tears, and hepatitis. A new question. A 18-year-old woman presents with 1 week history of sore throat, fever, fatigue. Examination may reveal cervical lymphadenopathy and splenomegaly. She denies weight loss or night sweats. Infectious mononucleosis, IM, also known as glandular fever, is sometimes referred to as kissing disease because it's transferred by saliva. It's commonly caused by Epstein-Barr virus, also referred to as human hepatovirus. 4. Intramuscularly classically presents in people aged 15 to 24 years old with a triad of fever, sore throat, and lymphadenopathy. Patients may complain of headaches, fatigue, malaise, anorexia, myalgia, muscle aches. Examination may reveal tender cervical or generalized lymphadenopathy, splenomegaly, and less commonly, hepatomegaly. Pharyngitis may be exudative and can mimic bacterial tonsillitis, leading to inappropriate antibiotic use. Full blood count will show more than 20% atypical reactive lymphocytes or more than 10% atypical lymphocytes, with a lymphocyte count of more than 50% of the total white cell count. Manuscript test is used to confirm the diagnosis in the second week of symptoms and are less sensitive if they are performed earlier. Liver function tests indicate transient mild elevation in transaminases in most patients. Intramuscularly is a self-limiting infection and can cause results within 2 to 4 weeks. Conservative management, such as maintaining hydration and recommending simple anesthesiacs such as paracetamol and ibuprofen. Admit the patient to hospital if they are severe, such as having dehydration, stridor, difficulty swallowing fluids. Have patients avoid heavy lifting and contact sports for the first 4 weeks due to risk of splenic rupture. Chronic fatigue is common. Splenic rupture is rare and occurs in acute illnesses. Tonsillar enlargement can lead to upper airway obstruction, cardiac, renal, and neurological complications, and malignancy. The next question is: a 75-year-old man presents to the emergency department during the winter months with a 1-day history of cough, fever, sore throat, headache, and generalized weakness. The answer is influenza. Influenza, or seasonal flu, is an acute respiratory infection caused by RNA viruses belonging to the Orthomyrotroxin family, and there are 3 types of influenza viruses. A. Most common and virulent, responsible for outbreaks and epidemics. B. Which is often co-circulates with influenza A and generally causes less severe illnesses. And influenza C, which is usually mild or asymptomatic. In the UK, influenza typically occurs between the months of December and March. After an incubation period of 2 days, it presents with abrupt onset cough, chorussia, sore throat, fever, headache, myalgia, and malaise. Dysphoenza is uncomplicated influenza and may suggest a secondary bacterial infection. Its diagnosis is done by clinical features alone, which is circulating in the community. A nasopharyngeal swab can be used to confirm the diagnosis. Oral anesthesia and antipyretics, example paracetamol. Antivirals such as oseltamivir is indicated in severe and complicated influenza. If the patient is question. A 40-year-old man presents with headache, confusion and fever. Examination reveals lymphadenopathy and oral hairy leukoplakia, otherwise known as hairy tongue. The answer is toxoplasmosis and CMV. The diagnosis is cerebral toxoplasmosis. Toxoplasmosis is caused by intracellular protozoan parasite Toxoplasma gondii. Most immunocompetent patients are asymptomatic. Fever, malaise and lymphadenopathy may mimic infection mononucleosis. Cerebral toxoplasmosis presents as confusion, drowsiness, headache, fever, slurred speech and focal neurological deficits, gait disturbance and seizures. C2 MRI head reveals ring enhancing lesions. Other manifestations include chronic colitis, hepatitis, pneumonitis and myocarditis. Management is, for the most infectious in healthy adults, are self-limiting and do not require any treatment. For those who are immunocompromised or severe toxoplasmosis, pyrimethamine, sulfadoxine and folic acid are indicated. Spirulomycin can be used during pregnancy to reduce transmission to the fetus. The other case is a 39-year-old man presents with blurred vision and floaters. He's seen having long-standing HIV infection and most recent CD4 count was 24 cells. Diagnosis of retinitis is likely caused by cytomegalovirus, a beta herpes virus, also known as human herpes virus 5. Most